right. Good morning to the Board of Health, August Board of Health. We have a long agenda. I'm aiming to be done at 9:30, so I may encourage discussion to come to a consensus. You have the Board of Health minutes that were distributed for July 1st.
Peg, if I could just have us go back, we do have our new
that's right, sorry.
Our new clinical and community health services manager has joined us. Candy,
Sorry
are
about that.
you
Candy?
Still there?
I am here and I'm struggling to get my video up.
That's okay. So Candy joined us March 31st, and so she's been with us for a few months, but really came on board. This is replacing Kim Wilhelm, who was the manager overseeing all of our clinical and community health services. So Candy has been excellent addition to our team. Candy, would you mind giving just a very brief background on yourself and what has led you here to now being in public health at this point in your career?
Sure. I've been a nurse for almost 22 years. 20 of those years were in surgery. The longer I became a nurse, or the longer I was a nurse, the further away from home I got, and I always ended up working in other communities. So the draw to come back to my own community was high, and this opportunity came up, and I applied, and I'm very excited to be able to work within my own community and make the changes.
Yeah. So Candy's already been working on some great things and really providing excellent leadership during really uncertain times. So we've appreciated having her. Hopefully you'll get to meet her in the flesh sometime in the relative near future.
Oh, hello. Okay. All right. Sorry about that, Candy. Welcome.
It's okay. Thank you. I appreciate it.
Yeah.
Nice meeting everyone.
Thanks, Candy.
All right.
Candy, I just may add that Candy is doing an absolutely spectacular job. The timing she came with us was perfect.
Thank you, sir. Good.
All right. You have minutes that Kim prepared for July 1st. May I have a motion for their approval and a support? And if you could say your name when you do it, that will help us with the minutes.
Linda Stroll supports or moves.
And may I have a support, please?
Ray will support.
Okay, thanks, Ray. Any discussion of the minutes? All those in favor?
Aye.
Aye.
Opposed?
Aye.
Motion carried. Lisa, moving on to vouchers. There's some boxes in this voucher list here.
I know. I had to kind of spice it up a little bit. So a couple of boxes, nothing out of the ordinary, but I decided to box anything over 5,000. So the first item at the very top, it's going through our communicable disease fund, and so it's 5,400 for TB support from Lakeland. Also from Lakeland is the next one down is Dr. Johansson's medical director. That monthly invoice comes through. It actually shows up in several places throughout because it hits several different grants. The KK Zoo contract, which I believe you all reviewed either at the last meeting or the meeting before. Anyway, that's the invoice through June for the Back to Work Safe contract. The next item is a nurse family partnership. That's our annual mandatory program support fee. And so that comes through annually, once a year. Then the last items on the last page are 2 payments to King Media. The first one was the initial down payment. The second one is actually payment forward. We should have waited on that. It was a duplicate payment. We're still within the overall contract, so we have not overpaid. But there was, we paid the deposit against the contract, and then they sent an invoice, and we paid against that invoice also. We're doing fine on the contract, so no worries there, but it snuck through on us. So, and any questions?
How is that Dirt on the Weed campaign going, Jillian? Is that continuing to progress well?
Yes, the campaign has officially launched. So we have very similar content as you might remember from last year, focusing on safe storage and handling of marijuana products for legal using adults, some teen and youth prevention messaging, as well as education for pregnant and nursing mothers. This year, we're really excited because there is a new edition of TV advertisements. You can catch those on WSBT channel 22 out of South Bend. And we've got a lot of placements. We're pretty excited about how much ad time we were able to buy through that channel. So you can find those there. I actually have like the specific times that you can catch those commercials. So if you really want to know when, you can ask me and I can give you that information. But you should also be seeing it on our Facebook page, as well as just digital advertisement that has some geo-fenced placement in our area.
Great, thank you. All right, you have the vouchers in front of you for approval. May I have a motion for their approval and a second, please?
Wayne
Ken
McGuire.
Edwards, so moved.
Joe Wasserman, second. I don't care.
Okay, so I'm gonna say Ken moved and Joe supported. How's that? Any discussion? All those in favor?
Aye.
Opposed? Motion carried. We have 3 or 4 resolutions. So Nikki, if you want to take it away.
Absolutely. So these first 2 resolutions, and I apologize, they're not in numeric order. So we're going to start with resolution 313 and 314 because they are related. So we'll start with those 2. You also have a copy of a memo that was sent to the Personnel and Human Services Committee of the Commission regarding these 2 resolutions. So the first one, Resolution 313, is to accept some additional funding. And this is as an update to the comprehensive agreement for fiscal year 2021. It's not an amendment because we haven't actually signed it yet, but it is additional information. We did have a resolution approved last month by the Board of Commissioners accepting funding for fiscal year 21. But now they've added more to this, and with urgency, we need to accept that funding before it gets to an amendment stage, because this will be included in what's in the contract. So this is to accept some funding that is specifically for COVID-19 response. We've been given funding in basically 2 line items, but they have similar functions. It's in the Epi and lab capacity, but it's one award is $850,556, and the second is $90,000. So if we accept this, that will bring the grand total of our comprehensive agreement with Michigan Department of Health and Human Services up to $4,047,335. So this is approximately $940,000 that has been awarded to Berrien County. It is to be used on COVID-19 response activities, including contact tracing, case investigation, testing, infection prevention, and enforcement of executive orders. And that is spelled out in the contract language as to what those functions would be.
So Nikki, looking at this, I'm wondering, some people think that, we'll have a vaccine by Christmas, early January. what's really a realistic timetable on COVID? I mean, why this grant of money?
So these are coming from CARES Act dollars that the state received that they are passing on to the locals. In terms of timing for a vaccine, I mean, it's hard to say. And Dr. Johansson, I know, has been following this a little bit in some of the timing of vaccine development a little bit more closely than I have. It's still possible there could be a vaccine this winter, but a vaccine being ready to go doesn't mean everybody is then vaccinated. And we're still hearing that a vaccine as early as January still means everything must line up perfectly in all of the trials and production. And then there's the huge issue of actually getting it into people and building confidence in this. There's going to be a lot of vaccine hesitancy with this particular vaccine from people who might not otherwise be vaccine hesitant. So we've been told from MDHHS that the funding that we received starting in April, because we've received close to $600,000 for fiscal year 20. So for the last 6 months of fiscal year 20, we've been told that's part of a 30-month funding cycle and that the state is planning out resources for 2.5 years, starting from the beginning of the pandemic. COVID-19 is going to be with us for a while. We don't have any idea what funding might look like for fiscal year 22, but we have been awarded this for fiscal year 21.
Is that based on a per capita, or how do they allocate the dollars?
I'm not sure how that went out. There had been a lot of information gathering. There were a couple of different surveys that MDHHS had put out to all of the health officers in late June and early July, asking about how many FTEs you had doing certain activities, how many FTEs do you think it would take for you to do certain things, asking us how much we thought we may need in terms of performing these functions. So I don't know if it was a direct response of you get what you ask for, relatively speaking, or if there was a formulary. I do believe that case counts were incorporated into this. And we've also been told that MDHHS has held back a significant chunk of their CARES Act funding that they intend to distribute to locals, knowing that there may be some hotspots or increases in certain areas where more funding might be needed for containment at that time.
Thanks.
Nikki, do these funds backfill expenses we've already had, or this is all new funding for new events?
The funding that is in this resolution starts October 1, so
Okay.
It does not backfill. The roughly $600,000 that we have been awarded does have the ability to carry forward into fiscal year 21 if we don't spend it all in before September 30th. We're looking like it could be spent, but we're still doing some projections, and some of that is dependent on if there's additional hiring and what the timing of that hiring is.
Thank you.
Nikki, in the contact tracing and response, how, and I know it's somewhat impossible to know, but do you feel you're at 25% capacity, being able to do what you want to do, 40? I mean, where are you on that sort of spectrum?
Yeah, that's a good question. And it's hard to think about these activities in isolation, because right now we probably have 8 to 9 staff members that are doing case investigation, and they do some contact tracing as well. And then we have another 5 to 6, and Courtney, jump in if I don't have those numbers right, but we have another 5 to 6 that are doing contact tracing, but that's on top of their other duties. So that's not FTEs, that's number of people. We do have some temp subs that we have hired that are also helping with that. But so when all is said and done, there's probably 15 people we're trying to coordinate while also trying to provide immunizations and operate our sexual health clinic. Back to school immunizations is going to be very rough because we have a lot of, that's always a high demand time, but there's the added challenges of how to do that with COVID, and there were many months where people were not necessarily receiving their vaccines and may have fallen behind. So we're working out when the majority of the people that are doing case investigation right now are our nurses, but they're also operating our IMSS clinics. We're anticipating flu clinics and back to school increase in IMSS. It's hard to say. So we're covering everything, but the thing that is also different right now compared to May, and we'll show you some of the data here in a little bit, we've been in an area where we're having about as many cases. Our case count has been about the same as it was at our peak in May. But in May, the majority of our cases were living in nursing homes,
Right.
quite frankly.
Right.
And so doing a case investigation and daily follow-up on 20 people living in a nursing home requires a 45-minute phone call with that nursing home. Now, following up with 20 people who are out and about in the community, it takes a lot more effort for the same number of cases because they're in different settings.
Sure.
People also have more contacts now than they did. And as we're just getting further and deeper, and this is becoming more divisive, it's taking a little bit more time and effort to build that rapport with people so that they truly understand and have that trust with us so that we can have information sharing that is appropriate for containment.
So what I'm hearing is that the people who have been doing this work in addition to their other duties will probably need to be pulled from this work for their other duties as school gets closer. However school happens as school gets closer. Is that what I'm hearing?
That is certainly true. So some of those other big events that are coming, we also just having that patchwork of so many people and trying to coordinate, okay, this person can do this on Tuesday afternoons, this other person can do it Friday mornings, and the coordination of that when you have people that need phone calls every single day and making sure that, because at any given time we have probably 300 people between contacts and cases that we're making sure we have daily contact with. And sometimes we are somebody's only check-in to make sure that they are medically stable.
Yeah, understood. Okay. Okay. Thank you.
How confident are you, or what's the effectiveness of contact tracing if someone goes to a bar or at the beach or something, or they don't want to? It seems like it's much more complex than tracing an STD disease or something. I've read some things that there's some difficulty in getting, how thorough you can be in tracing patients.
Absolutely. I mean, there is a level of complexity, and I think there's also general confusion as to who counts as a contact. When we do similar work, as you mentioned, with STDs, that becomes a little bit more clear as to who may have been impacted. It's less clear at times with contact tracing. So there is a lot of trying to navigate and educate and ask a lot of questions of, okay, you were in this setting, but really who was near you? Who were you interacting with? What did those interactions look like, to be able to really make those determinations? And determining who the contacts were is something that happens during the case investigation process, and that is typically handled by somebody who has a little bit higher level of expertise and medical background, and is better able to do that. The contact tracing is then following up with the contacts to make sure they understand all of their quarantine needs. So it can be a bit complicated. It is a bit of a skill to be able to do that motivational interviewing, to build rapport with somebody quickly over the phone. And quite frankly, our nursing supervisor, Donna, who is really overseeing and coordinating this right now, I mean, she becomes part detective when we're trying to hunt down phone numbers. Because we don't always have those with the reports.
Yeah. What are our metrics for case response?
So the state is tracking, and I believe I shared one of these images with the board in the past, but the state is tracking some key metrics, including investigation and having made contact with a confirmed case and completed the investigation within 24 hours of referral to us. There's also, we need to elicit at least one contact from that case within that 24-hour period, and then have attempted to make contact with the contact during that 24-hour period. There's some other things of completion. How did we complete the investigation? Did we complete all the associated paperwork with the contact tracing? And how many contacts are we eliciting? All of these sorts of things are being tracked and monitored. We did hear yesterday from NDHHS, not us personally, but the local health departments on a state local call, that there have been, over the last few weeks, we've been talking about, there have been some persistent dips in those metrics Monday through Friday. On the whole, as a state, we are meeting those metrics pretty well. On weekends, it is becoming much more challenging, and there's a much lower percentage of contact made to cases. In Berrien County, we are still doing better than the state average, and we do have our nurses working on a bit of an adjusted schedule. So we have people who are assigned to work on Saturdays. We have people who are on standby or ready to work on Sundays, depending on what comes in. But the pace of work of needing 7-day-a-week coverage for this thing that is also on top of a lot of our other job responsibilities at this pace has been a lot. So we have some of that similar dip on the weekend where we're getting the work done and we're triaging and doing what's most important. Our performance is not as high. And the governor's office is really paying attention to this, and they're trying to urge everybody to, whatever it takes to get weekend coverage, we need to do that.
I'm sorry. It just seems like you just have not had a break at all. And we just, as a board, we so appreciate your work, but I don't see how this pace can continue without some additional staffing. So.
Would you like me to move to the next resolution?
I would prefer to approve this resolution
Okay.
and then move to the next one, if it's the pleasure of the board. May I have a motion to approve the update in the comprehensive agreement?
So moved. Ken Edwards. Sorry.
Okay, so Dr. McBride moved, Dr. Edwards supported. Discussion?
This is great. This is great. I'm glad there's some resources to help you in this overwhelming task.
Yeah. All right, all those in favor?
Aye.
Aye.
Opposed? Motion carried.
All right, so the next resolution is 314, and that is how we would like to spend the funding that you all just voted to accept. We would like to add some positions to our complement to be able to help with this. We are requesting to add 9 positions to our complement. 5 of those positions will be involved in contact tracing and case investigation, with a split of 3 that are disease intervention technician 2, which would be responsible for case investigation, but also be able to do contact tracing. Those are separate functions that have slightly different skill sets. So 3 FTEs of that, and 2 FTEs of the disease intervention technician 1, which does contact tracing only. It doesn't get into that case investigation, as it doesn't quite have that skill set we're looking for that. So that's 5 FTEs. Then there are 3 FTEs for a special health project coordinator. This is a position that exists within our complement already, and we have used it when we've had different grant programs that have come about. This has been a position, it is a grade 8 non-union position. It is currently being filled by our staff person who's working on the 4x4 grant, working towards nutrition and obesity. Those individuals would be tasked with a lot of the functions of and management and coordination of the support to schools and businesses, as well as providing some support in the coordination of contact tracing and disease investigation. The nursing supervisor will not be able to maintain that direct coordination that she's doing right now of all of the staff, as well as all of the immunization events that we have coming up in the foreseeable future. So that's how those 3 FTEs would be. And then also a communication specialist. As we've found throughout this pandemic, some of the most important interventions and actions that the health department has taken has been communication, being able to effectively do risk communication, making sure we're getting clear messages through a wide variety of platforms is really important. And we have just tapped out all of the resources. Jillian has been doing a tremendous job, but we know that there are gaps, pretty important gaps in how we're able to reach out and who we're communicating with. And as the pandemic continues to shift, and I think as things just become a lot more questions, people need information now, just like they did in the spring, and having somebody who has more of these content creation skills would really assist us in that service to the public and our other stakeholders. So I am requesting these to be created as full-time positions, as they're going with temporary supplemental employees. While it can be a more affordable option, often leaves us in a lurch with the 1,000-hour cap, where that employees are allowed to work. Sometimes our staff will run into those caps. So we need these functions going without having to really put that limiter on how frequently or how much they can work. I also believe that we are going to be able to do a better job of recruiting. If we have full-time positions, we'll be able to get some really good talent. And based on some of the applications we've had for similar positions recently, both the temps up disease intervention technicians that we've hired, as well as other applications we put out there for special health project coordinators, I do believe that we will have a good applicant pool for this. But the other thing, especially with the contact tracing, that becomes really important is that temporary supplemental employees don't have as much accountability built into their position for their schedule. And so it becomes a patchwork of, well, these are the hours I'm willing to work. And, oh, by the way, I'm not coming in tomorrow. And just that employment relationship is different than it is if it's a permanent position within our complement. And we just don't have the time to coordinate 20 people doing the same thing that we could have fewer people doing, and dealing with all of that schedule. That becomes another full-time job just to manage all of the schedules. So this is our request for how we would like to spend. It's a total of, with the proposed positions, it should be $653,000, which is well below the 940. We do have other non-personnel related expenses or expenses related to the response. So that does still leave room in our budget for those other pieces of response.
Nikki, Ken Edwards here, just wondering, would it be your anticipation that these would be self-limited positions as the pandemic wanes? These positions probably would retire at that point?
Yes, if we do not have the funding for them, we would not support them. And our department does have a history of when we lose grant funding, if we're unable to support the position from another funding stream, we do end that function. And I would see this being a finite period of time.
Nikki, do you think that the people who start out in these positions might, when the funding is over, be able to move into other needed positions in the department?
If we have vacancies, yes, and that's always a preferred option. If we have vacancies, we have a place for somebody. We never want to lay someone off when we have something else that they could be doing. Obviously, there's lots of considerations within the collective bargaining agreement and HR policies, but yes, that would always be the intention, that if we've got talent and funding dries up, we want to, if we have a place for them in the organization, we would try to keep them.
It would be nice. Funding. It would be nice if you could coordinate something with a hospital that they could maybe obtain a job, the postings or something, some kind of, so that would give them some possibility, stronger possibility of being absorbed into something more long term. Just a thought that may or may not work. The other is just it's kind of off base here a little bit, but compliance seems awfully important, and I hope a big component of what we do is to get people. I've noticed an uptick in compliance as I'm out and about, but I think working with small businesses, people, and young people especially. I know I see Benton Harbor is not going to open their schools up just to distance learning. So it seems like compliance is really critical, and it would be such a help to limit the occurrence of the infection.
I would agree with that. And very humbly, I would assert that we are not doing what we could to try to make sure that everybody understands the executive orders and has what they need to be able to comply, at least from a business's standpoint. We've been working with wedding venues that have a misunderstanding of what their rules are, because we definitely are concerned about mass gatherings. And so that is an area we have received many restaurant complaints in food service. We regulate those. We have a process and staff in place, so we're able to handle that portion fairly appropriately. But there are a lot of employers and other types of event venues that they want to do the right thing. They don't necessarily know what it is. And it will be part of the roles of our special health project coordinators that would be created through this resolution.
And the right thing changes from time to time.
Right.
You know, and I just read this week, was it that the amount of people allowed to be at a gathering, was it no more than 10? We're back to that. And so it's been changing so much. So people may think they're doing the right thing, but they're not.
Right. And that is an excellent example of what has been confusing, because actually in our region, we have been limited to indoor gatherings of 10 people since the stay home, stay safe order was lifted. We never were allowed to have gatherings larger than that. The Upper Peninsula was. And so that latest executive order walked back their limits to 10 people indoors.
Mm-hmm.
And so we've received lots of calls from people wanting to know, oh my gosh, we're only limited to 10. What do we do? How do we adjust? And so we're working to provide that education. But a lot of that is coming from our administrators. I mean, we don't have other people to assign some of these tasks to, and we need to be able to delegate that education to people who have time on their plate to be able to be responsive to those in the community so they can get quick answers.
Oh.
We all want to get back to business safely. I see this as one of the ways to support the county's goal of getting back to business. So just think it's essential. Any other comments before I call the question? All right. Yes, Bill.
I really am looking forward to Nikki discussing this with PHSC. I'm withholding comment. It's going to be a hell of a task to get the Board of Commissioners to agree to add 9 permanent positions for what many perceive to be a temporary, albeit long-term problem. Berrien County has tried very hard not to lay people off. And this is a group of 9 people that coming onto the job will know that sometime in the near future, 12, 18 months, whenever, they're going to go away. So just the 1 or 2 people that are aware of this proposal have been very outspoken about no way, temporary only. So uphill battle, but Nikki's an excellent communicator and she's a great advocate. So it'll be interesting to see what happens.
I was just wondering what would be their problem with this, because the money is coming from the state or the government and it's not coming from, you know, the taxpayer, if I'm understanding that correctly.
Well, that part, Vanessa, is very much correct. The county commission is going to look at this as 9 people who are part of the Berrien County employment family, and we don't want to lay people off. The other thing that's here is none of us know what just general revenue and activities are going to be available in 2021. You know, we're dealing in a void of economic support here. So it will be an interesting discussion for sure.
Well, I think one of the salient points here is that this is restricted funding. I mean, Nikki, if you didn't use it for this, what would you or could you use this funding for?
To send back to the state and be redistributed to a different health department.
Well, or for all the other activities that are listed there. It's for broad COVID activities, right, Nikki?
No, it is specifically for case investigation, contact tracing, testing, and enforcement of the executive orders.
It's restricted funding.
Yes.
Yeah. I mean, I've worked for an at-will employer for the last 43 years, and I never know year to year whether I have a job or not. I think maybe Berrien County may need to continue to work like the rest of the world does. We don't expect to be with an employer forever. And we've got to have these people, in my opinion, and it's a good job start. And I just think it's a different world. So.
And I'm not expressing my opinion. I'm expressing the opinions that I've heard from several others who are aware of this resolution. And I know how this discussion has come up with other organizations, particularly the Sheriff's Department, who is looking for a substantially larger number of people to bring onto his payroll because he got money from the CARES Act. So we'll see how it goes. Like I said, Nikki is usually very, very persuasive with our.
But Nikki's right. You're different caliber of people. If these are posted as regular positions, not temporary, it's a different caliber, much different.
Well, I think you also, I mean, we've had such trouble finding qualified candidates for other open positions in the health department. And it's possible that you will be creating a pool of people who could in fact step into other positions that might become vacant during this 18-month period. And we wouldn't be struggling the way we have in trying to attract
Sure.
appropriate candidates.
Example, after we do this contact tracing, and hopefully when we get this immunization, we're going to have people who's going to administer the immunizations, and that's huge. That's a huge amount of people. So, I mean, hopefully there is an end. And I think that's okay if when people go into the positions, they understand that this is kind of like going to be temporary and there is an end. And there are people who want those types of positions. So I think that we do have to sell the Board of Commissioners on this because it is very important.
I understand where you're all coming from. I'm just giving you another perspective.
Yep. And I think it's important that we tackle this from all angles and that we really shine light on it from every direction and have that conversation. So I too am looking forward to that with the PHS committee.
Thank you.
Thank you for your bringing the board's perspective, Bill. All right, you have a resolution in front of you. May I have someone to make the motion to have these positions added?
So move. So move.
So,
Second.
Linda.
okay, so Linda has moved and Vanessa has second. Yeah. Any discussion? All those in favor?
Aye.
Aye.
Opposed? Motion carried. All right, moving on to the third resolution with a mosaic.
Yes, so this is resolution number 312, and this is a contract for services with Mosaic CCDA. You'll recall in the spring we had a agreement with another organization to have isolation and quarantine facilities, that in the event that there was somebody who had a transient living situation, was homeless and was ill or exposed to somebody with COVID-19, they had a safe place to go for isolation and quarantine. The agreement with that organization has sunsetted, and we no longer have that facility. However, Mosaic CCDA has been fulfilling a similar role for homeless individuals in Berrien County through some funding that has come through for homeless individuals. So we are able to pay Mosaic CCDA for any necessary lodging if there are isolation and quarantine needs amongst the homeless population. So we are no longer doing that old plan of we would send somebody to a facility and the health of, if they needed it, that they would be at that facility, we would staff it and all of those sorts of things. We now have this other option where there's already a facility that's being run. We would simply pay, and it's a dramatically reduced cost, far less than it would have been for us running our own facility. This is a rate of $170 per night spent in that facility, and it does encompass meals and everything else that is needed. Mosaic CCDA does provide, whether directly or with other partners, some case management and other things so that the more holistic needs of an individual are being met while they are in isolation and quarantine. We did have an occasion to use this facility a few weeks ago, and we were in an in-between time where we really had no good option or a different option. So this is where we have used this. It all went very well, and this is a much more affordable option than us trying to maintain our own facility on standby.
Just aware in Harbor Country that I had 4 homeless families with children. So it's a tremendous uptick. Yeah. I have never had so many homeless people. So I think this is a great idea. So, yeah. All right. May I combine this resolution with the next one, if that's the board pleasure? I'm looking at 843 to just continue moving.
Go ahead.
Sure. So this this last one should be relatively easy for us. So this is the contract with Southwestern Medical Physicians as well as with Spectrum Health Lakeland. And this is the contract for medical direction that Dr. Johansson serves with us under. There were some changes. We're currently in a contract for the year of 2020. There were some legalese type things that Lakeland just needed adjusted and some formatting in the contract that they wanted updated as they've had some new staff members overseeing contracts. The content remains the same, the fee remains the same, the time period for the contract, but they wanted this newer version executed.
I guess my, Ken Edwards here, my only question is, why do we have any language regarding Southwest Medical Clinic? Since Southwest Medical Clinic is a subsidiary of Lakeland Medical Practices, which is the overriding employer of Dr. Johansson.
I don't know, Dr. J, if you can attest to why the contract is with Southwestern instead of Spectrum Health Lakeland directly.
Well, I guess it's complicated, but that's the way Lakeland has wanted to do it and continue to morph along. This is what Mary Ann Pater, in working with Spectrum North and locally, wanted to change. They cleaned up quite a few contracts, and in a way, it's sort of more relates me to Lakeland than it does to Southwestern, although that's the affiliate I sort of work through. On the other hand, all the checks and all the money and everything goes through Lakeland Medical Practices. So there's, in a way, it's sort of a moot point, but that's the way a lot of the contracts are. So I don't think it doesn't change anything in terms of the work or the work described or time or anything like that at all. It's a legal phenomenon as best as for sure.
All right, we have 2 resolutions in front of us. May I have an emotion to approve the Mosaic and Southwest Medical Clinic resolution?
Yeah, so, Ken Edwards, I'll make a motion to approve both.
And Ray will second it.
Thank you, Ray. Okay, any discussion? All those in favor?
Aye.
Aye.
Opposed? All right, Lisa, looks like you've sent us another good monthly report. Do you want to
Yep.
give us some updates?
So you have in your packets revenue and expenditure report for June. State, and just to run through a few data points, state and federal grant revenues through June are over budget by 3.6% or $70,000. We have received through June, and from a revenue standpoint, our statements are cash based at this point in the year. So far through June, we have received for COVID $86,800. We are also favorable for federal and state funding by 89,000 over last year, which is about 4.6%. Amendments to the comprehensive agreement added 135,000 to our essential local public health funding. And as we've discussed, an additional $645,760 for COVID-19 response this year. So that is through September 30th of 2020. Permits, inspections are over budget, 69,000. Much of our invoicing and billing for permits and inspections come through environmental health, and they come early in the year. So the sort of the better comparison is to last year. We are under last year about 25,000. I expect that may be a permanent loss of revenue this year. I'm overall expecting to have a decline in revenue on that line for the year of about 35,000 due to COVID and food service licensing is we're probably not going to see there's going to be a loss of temporary and seasonal licensing. Medicaid, Medicare, private insurance clinic revenues are under budget 61,727. So 46% variance, and we're down 21,000 compared to last year, which is 23% decline. The clinic was closed beginning in March for in-person visits. We did do some telehealth, but I'm expecting that revenue is also going to be a permanent loss this year. And I'm projecting a variance budget of about 50,000 on the year. Medical Title 19 cost Medicaid Title 19 cost reimbursement through June is over budget 120,000. Those payments are received quarterly, and then there's a kind of a true up process that happens. So I think that although it looks nice, I think that variance may be timing related. On the expenditure side, before county services allocations, we are under budget 11%, 358,000, and under last year. After I adjust out, last year included the Benton Harbor water filter program, and also we were still covering the medical examiner services. So if I adjust for that, this year's expenses are under last year about 56,000. We probably see a permanent savings on the travel line. We haven't been able to travel due to COVID. On the personnel related line, we are at this point through June under budget, 237, almost 238,000, which is about a 9%. We're about 9% under budget, and just slightly over last year, 80,000, 81,000, which is about a 3% increase. Most of that increase over last year is on the benefit line, so I sort of look at that overall cost in combination. The health department fringe rate is 48%. It was 45%, so we're seeing that slowly creep up year to year. The budgeted rate, however, for 2020 was 51%. When we budget especially for any staff turnovers or new staff, we always budget them at a family health insurance rate. So that has a big impact on our overall rate for the department. If we continue on the track that we're on right now, I think we will see a savings of about 115,000 over budget on the benefits line. COVID related expenses. So most of those expenses are people related. Through June, the overall expenses were 388,000. That includes 2 temp employees who we had one start the beginning of June and a second one, I think, later on in June. A third temp staff was hired in July. So we're looking good on the year so far. Bottom line, revenues are through June exceed expenses by 298,000, which is an improvement over budget of 562,000. If you turn to the fund statements in your packets, there's a lot of moving parts going on to the fund statement. So I have attempted to factor in the increases in revenue from COVID, from the additional essential local public health funding, some of the shifts of employees that are admin or in the 2210 fund statement have shifted into COVID, which is it's found within the 2215 statement. So I've also added some staffing costs for this year for contract tracing, PHN staff, benefits. So you'll see that on the combined statement, the 130,000, the 67. I will tweak those numbers as we go along and as staffing is approved, once I can kind of firm up those numbers. Additional medical supplies, PPE is on the supplies line. Cost for communications, additional phones, jetpacks, COVID related direct mail and postage. I'm showing a reduction in travel about 10,000, could be closer to 20, but I'm trying to be conservative. We have additional costs for Zoom, for computer equipment. We improved our dashboard. We have other office equipment, IT equipment. And I've included kind of a contingency amount of 100,000 and all of that within the expenditure category. So at the end of the day, I think that we will, at the end of 2020, be a little bit better than budgeted on the use of fund balance. So we had budgeted a use of fund balance of 528,000. I think we may improve over that to about 303,000, basically due to the additional revenues. And so I'm projecting we end the year pretty healthy fund balance as we go into next year. And I am in the midst of working on the 2021 budget. I have the salary and fringe numbers, and so I'm rolling through that process. So I should have better numbers for you as far as what 2021 looks like at our next meeting later on, at our prep meeting in August, or if we do a prep meeting, but definitely by our September board meeting. Any questions?
Feels like you're rolling on marbles all the time, trying to figure out.
There's a lot of moving parts. Thank you, Peg.
Questions on Lisa's thorough presentation?
It's, yeah, a wing and a prayer, Lisa.
I always appreciate and understand her reports. I really appreciate
Yeah.
Thank you.
But also you should be complimented. I know Bill is always concerned that we're good stewards of community resources. and you're demonstrating such incredible excellence at what is an unparalleled difficult time.
Thank you, Dr. Edwards. I really appreciate that. And we definitely, when we put our numbers together and do our projections, we work very closely with the programming and the resources and the funding that we have. So that to a certain extent, that drives everything else and how the rest of our budget kind of follows suit. So it's especially in a year like this, we're trying to be as agile as possible to react to each change, and they're kind of just flowing quickly. Thank you.
All right, Health Department administrative reports, please. Nikki, you're muted. Oh, okay.
Thank you. Sorry about that. And I'm going to make sure to pull my screen over.
Yeah, your screen
Let's
is
see.
up.
Okay. So
Yeah.
we're going to try to just move through these, be kind of brief, recognizing the time, but I do want to go over briefly what some of the data is looking like. And I know Dr. Johansson had some comments about COVID-19 response and data and where we're at and those sorts of things. So this graph shows the epi curve of confirmed COVID cases amongst Berrien County residents. It is a 14-day rolling average. So what that means is that each day we look at what has been the average number of cases over the previous 14 days. So it changes each day because it's a new 14-day period each day. So that helps smooth out some of the variation when we have really large testing events, or people tend not to be tested on Sundays very frequently. So those sorts of things. And you can see we had that pretty relatively slower increase up to our May peak, where we were having an average of about 16 cases per day. There certainly were days where we had 30 or more, but the 14-day average was at about 16. And this was largely driven by transmission in skilled nursing facilities. Then in June, we had that pretty dramatic decrease. We were at a very low level where we even had some days where there were no new cases reported there towards the end of June. And then relatively speaking, in the month of July, we've had a steeper increase. So the increases come more quickly than it did in the spring, with a peak that has been about the same as it was in May. We're averaging about 15.5 cases at the highest. Over the last couple of days, it has looked like maybe we're starting to come down from that, but it is hard to know, even if we are starting to come down, that we're going to continue to see the cyclical up and down until we reach levels of herd immunity. So a lot of this about this second bump here that we saw in July, we are doing more testing. So we know we're finding more cases. We know that amongst the cases we're investigating, they're a lot more likely to have mild symptoms or be asymptomatic compared to back in May, when we were really only testing those who were very seriously ill. So it's hard to really compare these two bumps because it's a very different testing landscape. But what is really helpful is to help us look at what was the percent positivity of tests. So this is showing us what percentage of COVID tests that we do come back with a positive result. And this is a 14-day rolling average of that to, again, just kind of smooth out some of that day-to-day variation. And you can see, I mean, early in the epidemic, we had a peak of 17% of our tests were coming back. At our low point, we were still doing in June, when we were still doing a lot of testing, but we were finding fewer cases. We were down to about 1.6%. More recently, we're hovering between 3.5% and 4.5% as our percent positivity, which is a fairly solid place to be. There are some figures out there saying you can feel fairly confident that you're capturing the majority of the cases out there. I don't know how much stock to put in that number, but we do know that that is an important metric, is making sure that we're having that percent positivity as low as possible. So we're covering a lot of the population with tests. People who are symptomatic are getting tested. We know people who are asymptomatic are getting tested as well. What also becomes really important in understanding trends, and this is the inpatient census at Spectrum Health Lakeland since the end of March. So this is the number of people occupying an inpatient bed who have confirmed COVID. it's not a deduplicated number, it's not admissions, it's just number of people in beds on any given day. And you can see here that in April and May, there were a lot more people in beds, and that corresponds with that first bump we saw in my first graph. And then not that many people were hospitalized when we had very few cases reported to us. And then there has been a bit of an increase here in July, similar to what we had with the confirmed cases, but you'll note it has not been as high of a bump. The hospitalizations are not mirroring what they did in May, just the confirmed cases. And this again points to, with testing, we're finding more cases. And so we're better able to identify the more mild cases. So it's encouraging. This is indicative, and the data is pointing towards we're seeing younger people that are showing up as our confirmed cases. We know younger people are less likely to need hospital level care for COVID. And we also know that some of these days, like right around here, where we had some higher spikes in census, there were some skilled nursing facilities in Cass County that were having some transmission and had multiple admissions to the hospital. So while it's not our county, so it's not quite comparable when we're looking at Berrien County confirmed cases, we also know that the virus doesn't really respect any borders, and those are people in our hospital catchment system. So that still matters from a healthcare capacity issue. But that spike or this peak here does not necessarily correspond with Berrien County residents only. And then the other thing that a testing strategy can't really mask, no matter what, is deaths. And so these are the number of deaths per day throughout the course of the epidemic. And you'll see we've had relatively flat since mid-June. There have been 5 deaths since mid-June. But we're not yet seeing a consistent upswing in deaths. And that is very encouraging. Again, a testament to the fact we're not seeing people ill enough to be hospitalized, which is resulting in fewer deaths, even though we have the same amount of increase in some of that cases. So this is really promising that even though we are seeing some increased transmission in the community, we're not seeing the same magnitude of really severe impact. I'm going to stop there and see what Dr. J has to add.
Thanks, Nikki, for that. As we said earlier, all along, the good measures will not necessarily be a number of positive tests, because that is so dependent on how many tests we're doing. And we are the #1 testing county. We remain that way in the state of Michigan. So we are doing a lot of that is thanks to Spectrum, who's been a great partner, and also Intercare, and then there've been a few other testing sites. So we are doing dramatic testing, and we remain #1, which is good. But if we look at these other things like percent positivity, it's very difficult to know what to do with that. There are health departments that are saying they might not want to, for instance, open schools if their percent is over 4%. But the numbers vary all over the map. There's the county that's really in the news now because they want to force private schools to open. They're saying if they're at a 0.5% positivity, they don't want they won't open any schools. So it varies all over the map in terms of percent positivity. I feel that's a pretty doggone good number. It is subject to, by the way, to some small little outbreaks and little wildfires do impact that number when you check a group that's been here or there. That does that up and down. And so statistically, significance-wise, we're really hovering between 3 and 4 with really no dramatic change. In terms of the hospitalizations, I think it's very important to note, as Nikki did, that the hospitalizations, at least 4 of them did come from one facility in Cass County. So that definitely will impact the number. But the other thing that's not really been said at all is that we all know that during the time when nobody was going into the hospital, there were tons of people with other diseases who delayed medical care. Ken knows that, as do others. And so a lot of people are now going into the hospital with serious conditions, who are, of course, all being tested for COVID, and many of them test positive for COVID. So there are people in the hospital that are there for conditions other than severe respiratory illness, but they get counted as COVID positive hospital cases. So that's important to remember. So some of these people are like younger people with some other illness that are there also. And oh, by the way, they're COVID positive. And that's a phenomenon in all over the country, and it's, I'm sure, a phenomenon with us also. And then looking at deaths, as you see, the death number is very flat and great. In our county, we're still at about 65. If you look at the number of deaths that we've, and the median age and the average age are both over 80. If you look at the number of deaths, and remember, I think every death is terrible, but the number of deaths in people under 60 in Berrien County is 5. 3 of those 5 were long-term care unit people. 2 of them were hospice. So there's only 2 other people in the entire duration of this who have died who are under 60. And both of those had many significant comorbidities. So those are numbers to keep in mind when we're talking about, you know, the impact. And when this is all said and done, someday somebody's going to look about the years of life lost, as is done with other things. And in this case, months of lives lost, since many of these people had months to live. Those are important numbers to keep in mind, especially as we talk about the most vulnerable populations and how do we protect them. And in regards to schools, I must say, as a pediatrician and as a public health person, that I'm very much for the opening of schools. I don't know if we're going to talk about that at all today. The Learn to Launch program, what Nikki has been incredibly involved in, is going to be rolled out. But just a couple of statements. This is from Mayo Clinic and multiple other places. I've said it for months, that children do not become sick as often as adults, and children rarely experience severe illness with COVID-19. That's not an opinion, that is a fact. I mean, all the data support that. Michigan's own website, when you look at their website now and they track deaths on their metrics, they have even removed, this happened this week, the under 20 deaths, because basically there are none. There might be one case in the whole state of Michigan, and that's true across the country. You have to scour to try to find a death, and almost every time you do in a kid, they have multiple other issues, like an 11-year-old on dialysis for 8 years. So I think it's really, really important that we open schools, and kids are really at incredibly low risk. And I'll read a statement from the American Academy of Pediatrics, if you'll let me. This has been their statement for a while. It still is there. As long as there are cases of COVID-19 in the community, there will be no way to prevent all risk of COVID-19 spread in schools. The goal is to keep the risk as low as possible and keep schools and school activities as safe as possible. If students do not go to school, they would be at risk of COVID-19 illness from their interactions in the community. Yet going to school is very important to the development and well-being of our children. It gives them proper education, social and emotional skills, safety, reliable nutrition, physical, speech, mental health therapy, and opportunities for physical activity, among other benefits. Our goals are to ensure that the benefits of in-person education far outweigh any risks. And if you read what the World Health Organization's others said yesterday, school closure may be the greatest generational catastrophe from this, and will affect us for generations to come. That's from the World Health Organization. And Dr. Fauci said yesterday, it's hard to follow exactly sometimes what he's saying, but the default position is that all schools should open, and they should open safely, and that should be the goal. So, you know, that's what's going on. But fortunately, we're battling some very, very difficult statements. For instance, on one of the networks yesterday was a Dr. Castrucci, who was described as a MD and former epidemiologist. I do it once an epidemiologist, always an epidemiologist, Nikki. But anyway, here's his great quote. He says, sending kids to school, and this was he had a major section to talk and was considered a featured speaker. But he said, sending kids into schools is like sending kids into a minefield. One child death is one death too many. So when you say something like that, then I would say that you ought to think about, well, nobody should be go swimming. Nobody should be running. Nobody should drive in a car. And probably for our 11-year-olds, we should chop up their food to make sure nobody chokes on anything. Because those kind of statements are the ones that just drive me and many of us absolutely crazy. At the end of his comments, he did say, however, that you should listen to people like Nikki Britton and local public health officials, because they really know the right answers, and we should look to them for guidance, and we shouldn't depend on politicians. So that was the end of the statement. So it's very, very difficult. So I've just put a little context of COVID-19 versus flu. They are definitely different illnesses. But in regards to children, if you look, this is data from now a week ago. This is CDC's own data. For the year 2018-2019, there were 400 kids, less than 15, who died from flu. 400, remember that number. And the average over the last 10 years of respiratory seasons has been about 500 kids, less than 15, have died from flu. The COVID deaths thus far in the United States, and actually some of the numbers are a little bit squishy. It's probably actually a little lower, but the number is 36. So put that in perspective, and virtually all of them are vulnerable kids. And I'm all for protecting vulnerable kids. So yes, we need to protect teachers. Yes, we have to look. Teachers at risk who are under 60 with comorbidities should be carefully, watched, maybe put in a different position. But doggone it, we really need to have schools. Thank you for letting me make my editorial. And I'm open to questions.
I think we may have lost Peg for a moment, but just to keep us moving, being mindful of the time, I'm going to go to Courtney for just a very brief update.
Hi, good morning. So I just wanted to share two brief updates with you. One is just an update on where we are at providing water filters in Benton Harbor. So you may have seen recently public notification and education that went out to city residents. So every 6 months, the city is doing their compliance period, and the compliance period that ended in June, there was an action level exceedance. So we're still working, and this is not a new exceedance. This is part of that continuation that we have been partnering with the city since late 2018. So I just wanted that to be on your radar and to talk about that for a minute. The city has been doing a great job getting public education and notification out. We've been continuing to partner with that. Water filters have still been available through this whole time of COVID. We've worked and transitioned how those are available to residents. And have really worked to get that communication out, and are working to do more of that this fall. But our three methods of getting filters out have still been: residents can come by the department here at our office here in Benton Harbor anytime, Monday through Friday. So we have a lot of people still stopping by for pickup. We have things safely packaged and can get them to them quite quickly. We still are manning our hotline and have staff answering that every day. And so an option is calling that hotline, and we have been mailing quite a few filters. So that has been a really good option during this time. Early in the year, we did pull back on doing some of our community distributions. A lot of that was tied with the closure of libraries and just wanting to ensure we weren't having people congregate in different areas. In May, we really decided we needed to have those back open to continue to have those three options. So either pick up, mail, and then community distribution. And so what we have done with those is created drive-through water filter distribution pods, and those have been working really well. So we're set up in Harbor of Hope parking lot there in Pipestone. We're going to add a second venue here in August as well. So we'll share that information, but residents are able to just drive through. We do the same paperwork. We've also been able to use that as an opportunity to distribute cloth face coverings. So just wanted you to all know that activity is still ongoing. Additionally, there is kind of a newer group, if you will, it's a collaborative group with Eagle, MDHHS, the City of Benton Harbor, our department, and then the Benton Harbor Community Water Council, just meeting regularly every couple of weeks to talk about messaging in the city and how to ensure that information about water and filters and other things that are happening are getting out to residents. So that work is all ongoing, and we'll continue to share that with you. The other piece that I think is later on the agenda, but just for time's sake, I'm going to pull and do a little bit early for you, is I wanted to share that we are still moving forward with our community health improvement plan. I think we talked early on that is the second step to the community health needs assessment. So We did an assessment, identified those health priorities. Now this is about saying, what are we actually going to do to address the priorities? We had some grant funding for this summer to help support some of that activity. So we've kind of coupled that with recovery, and we know that's an ongoing thing as we're in an ongoing response. So our community health improvement and recovery planning. We had intended to do a lot of in-person meetings in town halls. Of course, that has shifted. So right now we have a survey that is out to residents, just seeking what actions and strategies residents would really want to see, and addressing our 2 priority issues of obesity that was identified, and then mental health concerns. So I guess to keep us okay on time, what I will say is, following this meeting, I will email out to the Board of Health the survey link and just some of the messaging that has gone out to the community. I would encourage you all to give your feedback. We would love to have that as part of what we're collecting, or to share that with your networks. And then we're working on late August into September, identifying how do we set goals and really pick from those strategies what we're hearing is the overarching theme. So we'll be able to update you more about that when we meet in September, but wanted that to be on your radar. You may see that on social media as well. We're trying to get it out paper form, electronic. We've had some staff teams out doing some social distancing outreach outside to get survey feedback. So we're getting really good feedback across the community. So wanted that to be something that you were aware of that was happening. So I will follow that up with an email. And then you are going to hear from Kina a little bit later on our agenda, but I did want to take an opportunity just to share with you all that Ms. Kina King has moved into our Family Health Programs Manager role. So she is officially our manager over our Family Health Programs area. We're really excited to have her in that role. She brings just a wealth of community knowledge and ability to build teams and really serve our families. So we're excited to have her in that role, and then I'll let her speak a little bit later on the agenda. She's just going to share a new activity that's been happening this summer.
I had a question. I didn't hear you. You said that the lead level in the water is still high. And I just wondered how that process was going, where they, put the solution into the pipes and it was supposed to be coating. And where are we with that? How is that working? Is it not working? What?
Yeah, that's a great question, Vanessa. So yes, the action level exceedance means that still in that 90th percentile, there was high level of lead detected in the samples. That is still from the lead service lines or in the house. So that piece of it, the corrosion control that you're referring to, that is still in progress. So we're just past, I think, a year of that being in place. And it does take time for that to really coat an entire system, because that is put in at the water plant and then goes out across the city distribution center. So they had kind of prepped us that when that started, it can take anywhere to 12 to 18 months to start showing that progress. And then it takes time after that for it to not, you have to have a couple compliance samples after that to say it's effective, it's coating, and that everything is working as they would deem it acceptable. So we are just in that 12-month period. And so hopefully we'll start to see some of that improvement as we move into the next compliance samples. Eagle works with the city on that, and they're working very closely and do a lot of that testing. So, yeah.
Well, I think that a lot of it is the pipes in the homes, and
yes,
I'm not very optimistic that this process is going to resolve that. And and in the meantime, the lead is in the water and so on. So I guess
I don't. Oh, go ahead.
I guess we just have to. But after this period of time, it's been over a year, right?
Yes.
And we're not seeing any change. And I understand that it
So-
takes a while, but how long, because I've read things that said that other communities have tried that and it wasn't successful. And, I'm worried that we're just, spinning our wheels here, and it's at the end, we're not going to have achieved our objective. I mean,
So I know we haven't talked about this in a while, but if you'll remember, we had kind of an image that showed a short-term, a midterm, and a long-term goal. And that short-term was providing filters and talking about flushing with residents, right? And then that midterm was the corrosion control. And that can take a year and a half, 2 years to really be effective. So that truly still we're in that period. But the long-term solution really is replacing the lead service lines. And if you'll remember in the lead and copper rule, there used to be a division on who was responsible for what pieces, but now the municipalities, the cities are responsible for that whole lead service line. And I don't want to speak on behalf of the city. I do know that they have been doing a lot of work on acquiring funding to do that replacement. It's incredibly expensive, but they've been working with Eagle, so Department of Environment, Great Lakes, and Energy. Sorry, it's easier to say the acronyms. But they've been working with Eagle closely to acquire different grant funding to accelerate their ability to replace lead service lines. And that's truly the gold standard outcome we want to see. And so that is in process. It takes a lot of funding and time. So they are working on that quite diligently.
And I'll just add the way all of the water quality policies and regulations are written, it really is to maximize the finding of lead. And if your sampling pattern and strategy is always going to be try to find lead, it becomes very hard to get out from under one of these action level exceedances because you're still in the mode of trying to find all of the lead. So it's a bit of a struggle. I'm not sure there have really been many communities that have come out from one of these action level exceedances without significant investments in replacing water mains and household fixtures. And the city is doing some of those things. It's not all immediate. It does take time because of the significant resources.
thank you.
Nikki, excuse me, I apologize. I have a medical appointment. I've got to go. So thank you all and we'll be in touch.
Thanks,
We're
Bill.
counting on you,
Bye,
Bill.
Bill.
All righty. Take care.
Take care.
Bye-bye.
All right, I am looking at the time. Is that the Health Department administrative reports, Nikki, or is there more?
I think that we do have Kina with us to talk a little bit about an initiative, the Virtual Mother Support Group, and I'd love to hear from her. I know she has prepared some comments, so if we could maybe skip to Kina, and
Okay.
we might go a few minutes over, but I'd love for her to be able to share with you. So Kina, do you want to take it away? Oh, you're on
And
mute.
Unmute yourself. We want to congratulate you in your new role. Woohoo!
Thank you guys so much. So I just wanted to share a little bit about our childbirthing education courses we just completed one of our first pilot sessions because of COVID-19 being part of the catalyst that initially started us brainstorming about the opportunity to create this virtual learning space for our expected moms. We're partnering with Region 8 and have purchased material from Enjoy to run the virtual learning space for our expected moms. And these courses will go for about 8 weeks. And we just finished our first one, so we are looking to really launch this off in late fall. And so we are also working with Region 8 with our childbirthing education courses.
What are some of the topics, Kina, that would be covered?
So some of the topics is relaxation and breathing, body changes, and we do have a doula that's working with us. Her name is Christina, and she is part of Region 8 as well.
So early on in the spring, we received some reach out of moms not being able to connect to like birthing classes. They were done in person and classes weren't being done in person. And so Kina and I had talked about that, and there was interest in an idea with our breastfeeding coordinator as well, Mistel, to do a virtual mother support group in class. And so the Region 8, I think we've talked about it here, that region is the perinatal collaborative. So that's kind of the greater Southwest Michigan region. They've been able to support some financial aspects of getting the curriculum. But Kina and Mistel have really built the program from the ground up to support our moms virtually, which has been really cool when there's the other options cost money or just were not available. So this has been an accessible option to more of our moms.
And Nurse Family Partnership, Jackie Clemens has also worked with us with launching this. And so we're very excited about that. We know that transportation is such a huge barrier for families. And again, just COVID-19 has been kind of like the catalyst for us to think about doing this, but we know that there has been a huge appetite as well as this providing an opportunity for us to further engage our expected moms. And so we're really excited about this. Again, we are doing, we just finished our first pilot sessions with our moms, and we're looking to have another pilot course that will start in about 2 weeks, and then really later fall, really looking to build this into our community with our moms. And so we're very excited about this.
That's wonderful. Thank you for the initiative. That's really wonderful. It just seems like we've been able to go forward in public health with COVID in ways that will benefit us in many years to come.
It has definitely pushed us in a way that we have had to be creative and think outside the box in ways in which that we need to meet the needs of our families within the community. And so again, just really excited about this opportunity and having the platform to work within the community and continue to provide the additional undergirding that our families need. And although this is this childbirthing education, these courses are something new for the health department. We're really excited about it because Lakeland does offer this, some childbirthing education classes, but it is with a cost. And so this opportunity will be free for our families. And so we're really looking forward to that.
Wonderful. Thank you.
Great to have you on board. This is a terrific program.
Thank you. I'm just, again, and thank you guys for all of the support. I'm so excited. I had just finished up a meeting when I heard Nikki saying that I was up next, so I just rushed right on. But again, I just want to thank you guys for all of your support, and I'm looking forward to continuing to work within the community. I am very passionate about the work that I do. You guys know I've been here for a little bit over 5 years, and I just know that I have a strong pulse on the community, and I look forward to continuing to work with the health department and continuing to engage our community in a way that would provide optimal health for all. So, thank you.
Excellent.
Thank you, Kina.
Very much, Kina.
Thank you.
Nikki, how would you like to proceed with the agenda in view of the time?
I guess the last thing I'd just like to say is make you aware of the Launch to Learn. Dr. J referenced that earlier in the agenda. So this is what we've been working with our schools locally on and with Berrien and RISA. So tomorrow we're expecting there to be a joint press release between the health department and RISA announcing this county-wide toolkit is in place. The superintendents and private school directors all have it in their hands right now, but it really is more of a guidebook for schools to understand a lot of the components of the roadmap and understand what our guidance will be to them in sections of the governor's return to school roadmap that say, consult with your local health department. So we've been able to iron out a lot of those things. I'm not sure that we've really reduced anyone's stress about the upcoming school year and planning for it, but we at least have plans in place for a variety of scenarios. And I know the schools are using that to communicate with their families, because virtually every family that's got children in school, at least in public school in the county, is deciding between virtual or in-person. Benton Harbor area schools did make a district decision yesterday to incorporate a lot of virtual learning. There's still some in-person for K through 8, but we're working diligently with the schools to try to make sure everybody has answers to their questions, and that we're helping to lay that path for some sound decision making. Jillian, I don't know if there's anything you'd like to add to any of this.
I think you pretty well covered it.
This has been a really big lift. It will continue to be a challenge in the coming weeks. And then once school actually gets started, I think it will, there's going to be a lot going on.
Well, Andrews is planning to start. In fact, all faculty, staff, and students are being tested for COVID. I did my test yesterday. You know, about 3,000 people in the next couple of weeks tested. So that might kick up some pauses, but
right. We do have the schedule of what groups of people and how many tests are expected on each day. So that has been helpful for us from a planning perspective.
yeah, I'm glad they're talking to you.
So I think that's it for updates or anything from the staff.
Okay, are we to assume the board prep is not going to occur on August 21st?
I would say yes, if that is okay with the board. Given just the format of the meetings, it feels like that's not the best thing we can be doing right now.
Okay, yeah. Unless anyone has any objections, that seems very reasonable. So
thank you for that.
Okay, is there anything else, or any other comments, or we stand adjourned?
I wish we could do something that made your life better. We're so appreciative of this, what you're doing in this crisis.
Mm-hmm.
I don't think you understand how much your support does make our life better. So we thank you for that. Appreciate the sentiment very much.
Mm-hmm.
Keep it up. Not
Take
over
care.
yet.
Thanks.
Thank you.
All right, we are adjourned. Thank
Bye-bye.
you.